I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator with Blessing Health System, here today with Jessica Nuebel, who is our nurse navigator with the Blessing Breast Center. If you could just take a minute to introduce yourself, tell us a little bit about your background.
Thank you, Laura. Like you said, I'm Jessica Nuebel. I'm a nurse navigator at Blessing. I've been with the health system for 22 years and in the breast center for about 5 of those years as the navigator. And I get to work with women who have just been diagnosed with breast cancer, along with women that are coming into our center, getting their imaging and risk assessments and helping them through that process.
So talk a little bit about, a big part of your role is also that maybe you didn't mention, is education.
Yes.
So talk a little bit about what you do in that role.
Okay.
Put on your educator hat.
Yes, perfect. So I am certified Mammogram self-breast exam educator. So I get to teach women how to do proper self-breast awareness. So how to detect changes in their breasts, how to get to know what their baseline is, and so they're more likely to detect changes if and when they occur. So I teach them things to be aware for changes that they need to watch for, report to their physician, different risk factors that they have control over, modifiable risk factors that they can work on to help decrease their risk of breast cancer and things like that.
So all very important things. And we're talking about this as we approach Women's Health Month. May is Women's Health Month. So we want to make sure that we're shining a light on all of these important issues because breast cancer is a huge risk for a lot of women. One of the things that most women should be doing is a mammogram. Talk about when someone should be screened, because I know that there's kind of been back and forth over the years. When do I get screened? What age? How does that work?
So we follow the recommendations of the American College of Radiology, and they recommend women of average risk start screening mammograms annually at the age of 40. Everyone should have a risk assessment by the age of 25, and you can do that by just talking to your physician, and that will help determine if you're at average risk or if you have an elevated risk, and there may be other screening tools available to you at an earlier age.
And what would put somebody at a higher risk?
So there are lots of things that could elevate your risk, but namely family history. If you've ever had a breast biopsy that had not a malignant finding, not a cancer, but a finding that that was a high risk finding. If you have dense breast tissue, like many women do, that can increase your risk of breast cancer. It also makes it more difficult to detect some cancers on mammogram. So there are other imaging studies that we use in those cases. There's certain genetic mutations that can put you at an elevated risk of breast cancer. The biggest risk factors for developing breast cancer are simply aging and being born a female. Some others are Ashkenazi Jewish descent, early age of starting your period, or late onset menopause, long-term use of hormone replacement therapy for menopausal symptoms.
I think that's something that I've heard a lot of people say is that mammograms,
oh my gosh,
they get hyped up in a bad way. And it's not like an entirely comfortable experience, but
no.
But they do a great job of making it as comfortable as possible.
Yes, and our girls at the breast center do a fantastic job. And it may not be the most comfortable, few minutes in your day or your year, but our technology is tremendous, and we are finding things earlier and earlier, and our treatment for breast cancer is so wonderful. So if we find a breast issue early, we can treat it very successfully, and that's the goal. early detection.
Talking a little bit about the risk factors and the risk assessment, what would maybe make somebody at a higher risk for breast cancer?
It takes into consideration many different things. Family history, your reproductive history, your tissue density, just to name a few things, weight, height, I said reproductive history. So it just takes in all those things and it calculates a score. And there's a threshold. And if you're above that threshold, you may be eligible for additional screening with your mammogram. Okay. So once you have that risk assessment done with your mammogram, your provider is notified of your risk assessment score, and then they can discuss with you if you're eligible for that additional screening.
So the risk assessment, is it like a low, moderate, high, or
no,
is it kind of?
It's a numerical value. So we do 3 different risk scores in the breast center. Some of them come out with percentages, and some of them are just a number. So it just depends on which score you're looking at.
You talked about tissue density. That was something that's like you hear a lot about that.
Yes.
And that's something that's normal, correct, for the density to change over time?
Yes. So young women typically have more dense breast tissue, and as we age, that density lessens, which is very typical, even though we see some older women with dense breast tissue. On a mammogram, dense breast tissue shows up all white. Well, cancers show up white on a mammogram too. So the cancers can hide in that dense breast tissue, so they can be hard to detect. There are supplemental screening tools we can use for women in those higher tissue densities that go along with the mammogram. They don't replace the mammogram, but they can go along with it to help detect abnormalities in the breast for women with those higher tissue densities. So that's something when you come in for your mammogram, once the radiologist reads that mammogram, they determine if you qualify for the additional testing.
So having dense tissue in itself is not dangerous. It just is harder maybe for the radiologist to read.
No, it also is a risk factor for breast cancer.
So it is, having dense tissue.
Yes. When you come in for your mammogram, just know the radiology, the mammogram techs, they're asking lots of questions about your family history. The more information you can provide them and the more accurate, the better score they can give you, the more accurate a risk assessment score they can give you, so that your provider has more accurate information to help counsel you on your risk. So that's why they're asking you all those questions.
So those are all things that might increase your risk. And when you're 25 with your primary care provider, those are things that they should be discussing with you to kind of determine whether you're normal risk or abnormal risk.
Absolutely.
What about, you mentioned, family history. Obviously, that's something that people can't control. What are some of the modifiable things that people could maybe think about making changes to?
Yes, things that we can work on that we have control. So the things I mentioned, we don't really have control over, but things we can work on are our alcohol consumption, smoking, weight, having a healthy weight, especially in postmenopause. It's important to maintain a healthy weight. Diet, low processed meats, high in fruits and vegetables, and exercise, intentional exercise, at least 30 minutes a day, most days of the week is what's recommended.
And so those are the things that people should be thinking about as they think about all the things that increase our risk factors for breast cancer. Is there anything else that maybe women should be aware of or be thinking about in terms of signs, symptoms, things that maybe feel off to them beyond a breast self-exam? Anything that might tell a woman, like, maybe I should get this checked out?
So when I educate women on self-awareness, so it's not only by feel, but also by looking. So if you're not doing a self-exam day to day, but you're just out of the shower looking in the mirror, if you notice any skin changes, dimpling, or pulling in of the nipple or any skin of the breast, redness, swelling, let alone any lumps or hard knots in the breast or the armpit, any itchy, scaly sores on the breast, sudden nipple discharge, pain in a spot that comes on that won't go away, changes in the size and shape of your breast. Those are all things that you would want to report to your provider right away.
What else can we talk about that maybe people aren't aware of? The Breast Center does a great job of getting out in the public, about sharing education, about talking about issues and risk factors and things like this.
I just think it's really important for women to get comfortable with their own bodies and be familiar with their like I said, their baseline, so they're aware when something changes. It's more likely that they're going to find a change in their body between the 1 year mammogram or the 1 year physician visit. So it's really important that they get comfortable with themselves and are familiar with their body so they can detect those changes. And promote getting your annual screenings yourself, your friends, your families. It's so important. We know that mammograms do just such a great job with early detection.
Thank you so much for being here today and for promoting a very important issue for women coming up in Women's Health Month.
Thank you.
Thank you.